So, welcome. I'm very excited to talk about my pet package, the ggehr, to explore real-world hospital electronic health record data. Okay, yeah, I'm a statistician and I work with the real-world data, and that is the hospital EHR and the larger public health registries. I did my PhD on EHR. On the side, I'm an art developer and I use our packages, Shiny and Quarto, for a variety of tasks. I'm also a co-lead of commits along with Christina and Elaine, and I contribute to some real-world data projects on the side. So let me give you some background about what we are dealing with. The topic is about the electronic health records, and that is a kind of data it's generated throughout the patient encounter with a healthcare system. And when a patient enters the hospital, he or she gets through the admission, get a bunch of measurements, and eventually he or she gets discharged. And these data that I have circled in blue, they are our electronic health records, or EHR. So this kind of data, it's not research quality. It's not RCT, it's observational in nature, and they are multimodal, mixed type, and temporal and static mixed all together. So it is very prone to error and missing. And you cannot just put EHR data into the LLM. So the EHR data that I'm I'm more familiar with is MetaVision. It's developed by AMD Soft and used by 27 countries, over 400 hospitals. So it's quite popular. Doctors and nurses, they use the user interface and they point and click to prescribe and register the actual uses of medication. And this is the example what they are seeing. You see on the left, it's a list of medication. On the right, with the timestamps, they are the actual prescriptions or planned prescriptions. So this user interface is pretty handy to see. You can see exactly what is going on. But when we want to analyze the data as the data analyst or statistician, this is what we see. They are in Excel sheets, and you don't really know what is error or whether those empty spaces, they are correct, or it's just data recorded in multiple columns for one variable. And it gets worse if you want to combine different tables together. Not only do you have to deal with the strange things in Excel sheets, you also have to check, is there like some strange alignments, for example, time. We've analyzed some data in the real world in the Norwegian hospital. We found out that 3% they have medication uses before the prescription, which is strange. And 50% of the drugs they used, they have mismatches. So physicians and the infection control team, they usually have a good idea of what's going on at the hospital, but analysts like you and me, we do not. We are not doctors. And we would like to have a quick way to understand how events happen around the patients. How is the data quality? And what are the possible causes for errors, mismatches, and missingness? And visualization is a very good way to do that. And that is why I developed this pilot package called ggehr. So it's pronounced ggehr because it's a ggplot2 extension for EHR data. It's a very early stage, it's not ready for release, and the data I have used for demonstration, they are simulated as close as possible to reality. And this is essentially a set of R tools to visualize mixed type of information related with one patient. For example, on the right, you can see the static information, the patient ID 10. It's a female of a certain age. When was she admitted and how long she has stayed there, which department and what kind of admission. And also you can see the temporal events that are plotted over time, the kind of antibiotics use, where she was at the time of each use. So the motivations of me developing this package is that I would like to have an overview of events happened to one patient ordered by time so that I know what happened first. And this also can help me identify errors and strange recordings. Ideally, we would like to have mixed data types in the same plot. we would have static data, that is demographics, admission information, and temporal events like treatment, drug procedures, and also locations. It's implemented as layers because this package is inspired by ggplot2. So potentially you could add more layers such as locations, physiological time series, and catheters, procedures, whatever, etc. And the motivation that I wanted to develop this is to understand better the drug prescription and use. You can plot them together with this package. For example, when I use the antibiotics here, it's colored based on the WHO aware categories for how severe the situation has become, if the patient got better or not. And in this way, you can identify if the use of drugs has escalated with a color. And you can also identify visually if errors and strange things exist in the data recording. For example, on the right, the black dots, they are the prescription time, and they are all before the actual drug uses. So that is correct. But you also see two drugs, they are never used after prescription. And more interestingly, you can visualize prescription times and purpose interactively with the ggehr package. I like this feature in particular because it's quite fun. So the patient background card, that is essentially a string that is parsed nicely so that it can provide some patient background information like age, sex, admission-related info, potentially also diagnosis, because when we communicate with the clinicians, we would like to know what kind of patient this is. And yeah, that's exactly what I said. Also with other kind of information like locations, they can be visualized like color blocks. And the multiple layers, they are stacked with patchwork. So it's quite flexible, and you can add on as many layers as we want. And I believe this way, the analysts, they can have a better overview of where the patient is and also the time order of the events. So this is ggplot2 extension for EHR data. Why do I not want to use Shiny or Quarto? Because everyone is using Shiny or Quarto. Well, it's because we have limited resources, and I'm essentially doing it on the side. It's not yet production level in any way. And our package, it could potentially be used by everyone that has this kind of data and want to use it. And I believe that a better exploratory data analysis leads to better research questions and better analysis. It's very early stage, and if you have a use case and or a data set to demonstrate with this package, you are very welcome to create an issue or talk with me. And I would love to implement that. So I have provided the GitHub link here. It's not anywhere close to a current submission, but I hope it will get there. And next step, I would like to aggregate visualizations for cohort. So you want good data, and to have good data, well, to check the data quality, plot it is a very easy and convenient way. And here is the last page of my talk, and just a little advertisement. I'm looking for new jobs, so if you have anything, just send me an email. Here I conclude my talk. And yeah.
All right. Well, thank you so much, Chi, for the wonderful presentation. And I was telling our colleagues in the backstage, I've had very brief experimentations of VHR data being synthetically generated, but I know what I'm going to use for visualizing it. So the package looks absolutely wonderful.
Thank you.
Yep. I'm not seeing anything in the chat, but they can always follow up with you on Slack. But also, if they want to keep in touch with your efforts on the package, where's the best place for them to keep up with your efforts?
Well, this is on GitHub, so you can always reach me on GitHub, or I could share the slides, and there is my contact, and people can reach me there.
Awesome. Awesome. Well, thank you so much, Chi. And yep, we will we have a couple of minutes to go to our next session. Thank you very much, everybody. We will see you on the other side.